sorry again po sa inyo dyan na apektuhan po ng lindol. Hello, Benedict Bench. Hi, Lodi, Sir Jack. So he's saying that you are his idol.
Why?
Yes.
I'm just a man.
So Mar Hufana saying hi po, Doc. Of course, Cecil Castro saying hello po, Doktora, Sir Jack. And Marizac, okay, he's asking for fatty liver. Okay, before that, okay, before everything else, I just wanna say, I wanna tackle one very controversial topic right now. Because a couple of days ago, there was one follower who's asking, Doctora, can you talk about meningococcemia? I remember when that meningococcemia came. It's a bacterial disease, okay, of the blood. By Neisseria meningitis. Everyone was so afraid of it because it's so infectious, okay? So, but we're gonna talk about that, okay? We're gonna talk about meningitis first, and then after meningitis, we're gonna talk about meningococcemia. Yung nakakatakot, di ba? So, what happened is that if you have a meningitis, okay, this is usually caused by a bacterial, so viral and a fungal infection. So hindi po lahat ng meningitis is caused by a bacterial infection.
Grabe naman!
Yes. Majority is a viral infection. And we usually have those types of bacteria, those types of viruses inside our body, but it doesn't infect us.
Well, that's why it's very important to always have a very, very strong immune system. Because these things are constantly out there and affecting us and trying to invade us.
Yeah, even polio.
Yeah.
We all have, some of us can harbor the virus. Some of us, yeah, we can be carriers. But if our immune system is very strong, madali lang sa atin yan, we will not be infected. So it's very important that we consider having a great nutrition. Kasi sabi ng ibang literature, if you have a great nutrition, if you have a perfect nutrition, most types of illnesses can be combated by a perfect nutrition. The problem is we do not have a perfect nutrition. And some doctors, if you ask them, what is a perfect nutrition, they do not know how to answer.
Correct. Well,
yeah.
but you, on the other hand, Mom, you are Harvard certified now in evidence-based nutrition. So I think you can probably accurately answer that question.
Yeah, but it's to talk about that, it's gonna take a while.
Oh, right.
I think the 1 hour is not enough to talk about the perfect nutrition, because perfect nutrition starts from the soil. Ano yan eh? The community is involved, starting from the farmer. The farmers are the ones that are mostly responsible, because they are the ones that cultivating the soil. So, if you have a farmer that is irresponsible,
like someone burning off the soil.
So irresponsible when they're trying to grow their crops, then of course the people that are eating those crops are also affected. But probably in the next FB Live, we'll talk about what is a perfect nutrition. So, going back to meningitis, so usually yung virus, bacteria, or fungal organism, they would go to the meninges. So the meninges, that's the covering of your spinal cord and of your brain. So they get inflamed. So nagkakaroon po yan ng inflammation. And if you have inflammation, the classical signs and symptoms of fever, headache, so it's all there. Nagkakaroon ng local rigidity, and they are usually treated, if it's a bacterial infection, they're usually treated with a antibiotic. Yeah. So, but the other types, if it's a virus, it cannot be treated by an antibiotic.
So, if you have a viral infection and you are prescribed an antibiotic, you simply need to ask why. Because it will not
help.
Not help at all.
But the thing is, this is what most doctors are thinking, because if you have a viral infection, you are immunocompromised. So if you're immunocompromised, you are most likely to have a concurrent bacterial infection. So they would also give some antibiotics along the way.
As a prophylactic measure, which is not a smart measure. That's what leads to antibiotic-resistant bacteria.
Yes. So what about meningococcemia? So, ang meningococcemia naman po, it's the bacteria Neisseria meningitidis. Yun po yung bacteria. It goes to the bloodstream. Okay? And then you would have clotting factors difficulty. So, nagkakaroon ka na, that's why you have rashes, diba? So, you have the typical purple, greenish, bluish rash all over the body because it affects the blood primarily, meningococcemia. But that's a rare condition. Yun lang, it's very scary. Of course, if it's a disease, whatever disease it is, if the patient is immunocompromised, mababa talaga yung immune system, talagang nakakatakot. Oh. But for the majority of people, if you have a very strong immune system, kayang-kaya yan ng ating pong immune system. Okay, so don't be afraid. We just have to be vigilant when it comes to that. And Jehovah has given us all of the soldiers inside our body. We just have to fortify it with proper nutrition. So most probably, next FB Live natin, we'll talk about perfect nutrition. And what is perfect nutrition?
Mm-hmm.
Yeah. How about you, Sir Jack? What is perfect nutrition for you?
Well, basically, one of the major factors is eliminating as much sugar as possible from the diet. Attempt to go organic, because there are people that will simply try and say, oh no, there's no difference in organic. Sorry, that's not what the science says. It definitively shows that sugar is highly inflammatory. And inflammation is a significant precursor as far as cancer is concerned. And organic agriculture has been definitively shown in numerous studies to be healthier than non-organic. Now, obviously, you see a lot of backlash with that, especially with regard to studies funded by the United States Department of Agriculture, because organic farming is typically more expensive to do. It's more labor intensive. What you have to realize, that's one of the reasons why in the United States
it's difficult to farm.
Coconut oil is so demonized, because when you look at the vast, hundreds of thousands of square kilometers of farmland across the U.S., it's not geared towards coconut to make things like coconut oil.
So, Sir Jack is talking about sugar.
Correct. It's geared towards making corn, not palm. So that you're not going to promote something uber healthy like or coconut oil from grown from coconuts. You're going to promote corn. Corn, which is made into animal feeds, which is made into ethanol, which is made into high fructose corn syrup.
So the sugar, okay, kasi ang recommended daily intake of sugar natin is 60 spoon in a day.
But the thing is,
if you are here in the US, the average intake here is 22 teaspoons in a day. So they're almost everywhere.
Do you require it at all?
Our body needs a small amount of sugar. We need it because it's a form of energy. But if you take it as many as you can, yan ang problema natin eh. If you're taking it as level, they are toxic to our body. But we need it at a small amount. They are source of energy.
Which can be achieved through fruits.
Yes. Okay. So, I hope that I was able to answer about meningococcemia po and meningitis for all of you. Again, I just want to reiterate, important na we have a very strong immune system. Importante lagi yan. And we can achieve them through perfect diet, okay? Perfect diet and exercise, of course. And less stress. O, mamaya niya, lagi kayo na-stress. Saan nyo kukunin yung pera nyo? Where are you gonna get your money? Okay. So, my first question, to get the doctor shake, okay? What is